Hello, everyone, and welcome back to the Heal with Grace podcast. I have a wonderful guest today who's going to really help break down and explain to you why you might be having chronic dizziness symptoms and that it's actually a good thing because it's a nervous system issue, which you can definitely recover and heal from, like we talk about on this podcast. We have Dr. Yonit Arthur, who is the steady coach on YouTube and social media. And she is just such a beautiful example of how to get this information across. Dr. Yonit received her doctorate in audiology from Purdue University and is a licensed audiologist and coach. She is board certified through the American Board of Audiology and holds vestibular rehabilitation, advanced vestibular rehabilitation, and concussion certifications through the American Institute of Balance. She has undergone extensive training in counseling, including internal family systems, level 3, inference based cognitive behavioral therapy, exposure and response prevention, emotional, expressive, and awareness therapy, and mindfulness based techniques. She is also a certified strength coach. Dr. Yo also has a YouTube channel, The Steady Coach, and has built a completely free, comprehensive course for people dealing with chronic dizziness. If you have dealt with anything that includes vestibular migraines, PPPD, MDDS, tinnitus, even elements of POTS, which we get into, anything along those lines, you 100% want to listen to this episode. Without further ado, let's go ahead and jump in. Hello, Dr. Yonit. Thank you so much for showing up here, and having you on the Heal with Grace podcast is an honor because you are huge in this community. And I'm really excited for people to understand the nuances of chronic dizziness and the whole umbrella that it covers. So thank you for being here.
Thank you so much for inviting me. It's such an honor to be here. And thank you also for the amazing work you're doing in this space.
Yeah, for sure. So, for people that don't know you, why don't you go ahead and give us an idea of how you got here, how you got to specialize in this, and a little bit of your story?
Yeah, sure. So I think the headline of the story is that I burned out being a regular audiologist, or what I like to call a real audiologist, because what most audiologists do is definitely not what I do now. So I'm trained as an audiologist, got my doctoral degree, worked as an audiologist for a while, saw people with all sorts of chronic problems, as we all do. Just didn't have, shall we say, the avenue to actually help them in the way that I hoped to help them. So, of course, this is skipping all the details, but essentially I burned out and ended up with chronic back pain along with chronic
Mhm.
migraines and, symptoms because, you know, stress and symptoms are related. Who would have thought?
Really?
But I didn't necessarily put two and two together just yet. I actually went back to do some more learning, and my mom developed chronic dizziness, and then through all sorts of interesting life events started to realize, hey, I actually can help people. I just am going to need to do it outside the framework of a typical audiology job. So I started working as a contractor. And when I saw these people, they needed me to repeat myself a lot. And I was learning a lot with them. So I started making videos for them and for me so that I didn't have to constantly repeat myself. And so I could gather my thoughts, and other people started watching them. So that's how I ended up with a YouTube channel. It was totally an accident, to be honest. I never thought anyone would watch those videos. And the evidence is clear. If you look at my early videos, they were not intended to be seen by, by a wide audience. They're like crooked and the lighting's all messed up. But it turned out that chronic dizziness is very poorly understood and very poorly treated in practice, despite having mountains of evidence pointing us to the kinds of treatments that actually will help chronic dizziness. So there was just an area of great need. And it's been an enormous pleasure and privilege to be able to help meet that need. And I'm so happy to tell you this. I'm going to start the podcast by just bragging about this for a second, not about me specifically, but just we're making a change.
Mhm.
There's momentum now in the vestibular world. The actual clinical practice is changing, and I'm starting to see people being referred to my channel by prestigious medical clinics. And I'm starting to hear from patients, hey, my doctor told me this could be stress related, and they pointed me to you. I know, I know, I know.
Yay.
Yeah, yeah, yeah. So it's
That's
changed a
exactly what we
lot.
want. That's what we want.
That's what we want. Yeah, it's incredible. So I've been obviously heavily involved in that, and it's just the most gratifying thing ever.
Amazing. Yes, there's a lot of momentum in this field right now, and it
There is.
feels really great, especially I've talked about it on here, like being at the conference and being in that energy, right? And there's a lot of push. And at the same time, there are these different sectors, right, of symptoms. And yours is very much so one that I don't think many people would ever think about stress related, right? We think of a headache, okay, sure, stress related. Obviously, still people go down the route with migraines and things, but still, anyway, there's not as much. So let's get into that. What kind of conditions actually fall under what you term chronic dizziness?
Okay. So let me give you some of the diagnostic labels first that people end up with, but then I'll say something about that. So persistent postural perceptual dizziness, or PPPD, is very commonly diagnosed now. Vestibular migraine or migraine associated vertigo, MDDS, Mal-Day Debarquement syndrome. Those are the biggest ones. I also see people whose symptoms are being blamed on post-concussion syndrome or cervicogenic dizziness, which is neck-related dizziness. And sort of to my point, the point I was trying to make a few seconds ago when I said I have something to say about these diagnoses, all of these diagnoses are defined by a list, like basically a checklist of symptoms. So we see you have episodes of dizziness that last a certain amount of time. You've had some headaches before in your life. And yeah, that's pretty much the definition of vestibular migraine. So not to say that these definitions don't have value, because they do give people names for what they're experiencing and help them find avenues of treatment that help them. But essentially, all the things I mentioned, and then there are many other descriptors, are really just descriptions of the symptoms themselves. They all basically mean chronic dizziness that we don't have a good medical explanation for. Like, you're dizzy, but we don't really know why you're still dizzy. You shouldn't be, essentially.
What might they be told about what causes dizziness that maybe they would grab onto from a physical standpoint?
Yeah,
Yeah.
goodness gracious. So, okay. And I have to say that this has been improving, because that's, I think, one of the things, again, this is just in my orbit. So maybe this is not happening as universally as I think it is, but it seems to me that people are showing up more educated now. So I'm hoping that we, meaning me, but also all the people that have listened to what I am saying and who've listened to other people in the mind body world, are now having an influence on what people are being told. So what they are typically told, though, is something to the effect of okay, they're kind of two subtypes. You have this damage. So for some people, it's an
Mm.
ear damage problem, or maybe some kind of cervical issue, neck related issue, or, you've had a head injury, you've had whiplash, whatever it is. You have this tissue damage, and this has basically just changed the amount and quality of information that your brain gets. And so the dizziness that you have is the result of this tissue damage issue. So very similar to pain in that regard. Totally wrong, because we see many instances of people with those exact issues who have no symptoms. And we actually expect most people to no longer have chronic symptoms after having one of those issues. But this is still what people are sometimes told. So that's category one, when we do find something wrong, right? But
Mhm.
for many people with dizziness, we find nothing wrong. There's nothing to be found. With migraine, they're basically told this is a genetic brain disease. It's an illness. It's a disease. And so they stop short of saying this is permanent damage. They don't use the word damage, but they use the word disease or illness. And they immediately jump into, and you're going to have to manage this for the rest of your life. This is now chronic, and there's nothing that can be done. You are now condemned to having this forever, but we can maybe help you by controlling diet and giving you these medications. For people with non-migraine diagnoses, sometimes they're told there's nothing that can be done. You need to learn to live with this, which is very obviously extremely helpful to people.
Yeah.
And sometimes they're told, again, sort of along the same lines, we know that this has something to do with how your brain is processing orientation related information. So that part is correct. And so therefore, this is a chronic problem that you will have for the rest of your life. And here's what we can do to manage it. So they're given, like, we have to change how you're thinking about it. We need to help you learn to live with the chronic disease. And maybe here are some SSRIs or some vestibular therapy that can help with the symptoms a bit. Again, I want to be fair. Not everyone's being told these things, but that's been the general talk track over many years.
And that's scary when it's the rest of your life. We can't do anything. This is management, disease, illness. We'll talk about how fear plays a role in a little bit, and that obviously is going to induce so much fear,
Yes,
which
of
I
course.
can only imagine, as we know, increases symptoms.
Right, right. I feel for anyone who has any kind of mind body symptoms. And to be clear, I see people, as often happens, people sometimes have more than one, shall we say, right? So they don't just have dizziness. They may also have pain. They may also have, gosh, name anything, pull anything out of the hat. People have them. But the reason to me that I feel so passionate about making a change in the dizziness world is because dizziness is just a particularly frightening and terrible experience. It disconnects you from reality in a way that other symptoms don't. It's not something that people understand. Everyone has normal dizziness at times, but while everyone has had some kind of pain that's persisted longer than a day, we've all lived that, right? Very few people have had dizziness that persists for hours, days, weeks, months, years at a time. It's not an experience that people understand. And the problem here is that it's not just torturous, it makes the process of recovery that much harder because you're given these just fear-mongering messages, of course, sometimes by medical professionals, and then you're living in fear of reality because you can't connect to reality and you don't have words to describe this experience to other people. You actually question your sanity. So dizziness, for so many reasons, these and others, is just a particularly awful experience.
Yeah. I remember you talking at the conference about this of completely pulls you out of your reality. And so actually there's nuances in how we work with it, right? Someone who's working with tracking their symptoms and their back pain is going to be different than tracking dizziness, right? And helping that. For example, so I'm like the textbook neuroplastic person who's had all different kinds of symptoms. I've had a few different bouts of vertigo. It did
I'm
not
sorry.
last in a chronic state,
Yeah.
but it was explained to me that I have the makeup of someone with POTS, and that was that type of thing.
Okay.
So where do you fit POTS? How do you explain it with dizziness? Because I do have a lot of people in my community with POTS, with chronic fatigue. Those seem to go together.
They do. And POTS is a little tricky because it has so many systemic, like direct
Mhm,
systemic effects. So with dizziness, we'll often see changes in heart rate and respiration and all that, but it's related to the anxiety and the disorientation from dizziness. It's not its own thing, its own
mhm.
symptom.
Yeah.
But in general, I think of POTS very much the same way that I think of the other symptoms that I mentioned. It just affects the autonomic nervous system. So basically, our automatic nervous system functions, which dizziness does too, but less directly. So with dizziness, I'm typically talking about changes in how we understand orientation information
Mhm,
and our
mhm.
sense of balance. Whereas with POTS, we're talking about how your body understands interfacing with itself and with outside
Right.
information. But from to answer your question of how I think about it, I don't think about it differently. I do think that people with POTS probably will relate more to my work than they might with to
Mhm.
someone's work about pain because I address some of these you feel disconnected from your body nuances that you might not get when you're just talking about musculoskeletal pain, for example.
Yeah, I would agree. I've had a few clients who they definitely have a combination of both, and the stimuli like lights and noise and really increases that dizziness. And anyway, I've sent them sometimes to your videos because I was like, she just talks about it in a different way, a specific way, right? That's
Yeah.
really helpful.
I'm glad it's been helpful to them. Yeah.
Yeah, yeah. So in that, I actually was watching a couple videos of yours just kind of going through, and you mentioned one recently around once you've recognized that you're grasping this as a nervous system issue, right? And you can actually help yourself and you can heal and recover from this. You mentioned two goals that need to happen for people when recovering. What would
Oh,
those be?
cool.
What are
That
those
sounds
two things?
great. Gosh, I'm so organized. I'm like, what video is that?
I was
Yeah.
wondering if you would know what this is, but I just in
Yeah.
general, right? Like kind of categorizing, okay,
Yes.
there's so much information out there. There's so much to grab onto.
Yes.
Like where would someone start? What yeah.
Yes. 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 And I've probably divided those categories up somewhat differently depending on when I've
Yeah,
spoken about it.
for
But
sure.
broadly,
Yeah.
it's how you're relating to the symptoms themselves, and then how you're relating to stress slash yourself slash other things in your life. Those are the
Mm,
two broad categories. And I
mhm.
think that in the mind body world, everyone knows we're supposed to relate differently to symptoms. Like I feel like that's broadcast across the internet now.
Mhm.
But that second piece seems really essential for people with dizziness in a way that I've
Mhm.
noticed it doesn't always seem as important to people who have other kinds of symptoms. Not to say when I hear any recovery story with any symptom, of course, there's some component of I lost my fear of the symptoms and there's some component of personal growth. But it
Mhm.
seems to me, at least from my experience, that this other piece, how I'm relating to myself, my stress, other people, my life, really does need to be addressed for people who have dizziness to get better.
Yeah. Can you maybe give some examples of what that looks like for people?
Yeah, yeah, yeah.
Yeah.
Okay. So obviously, I'm going to leave the symptom response piece aside. I'm sure your audience has heard a lot about how to respond more neutrally or more positively to symptoms. We'll leave that aside. So I'm trying to think of some good examples because it would be so nice to be able to illustrate this. So I think the simplest example would be something like this is kind of a classic mind body example. Someone
Mhm.
who's a big perfectionist. Right. So let's just say you've mastered the art of responding to your symptoms neutrally, but you also attack life in a very perfectionistic way. What that
Mm.
means is that any bit of stress that comes anywhere near you gets amplified. It gets blown out of proportion. Because, so say you have a work stressor, say you have a project assigned, you're feeling well enough, you're off medical leave, you go back to work, you get a project assigned to you, and the perfectionist kicks in and you're like, oh my gosh, this project. And you're like, I've got to make sure all the T's are crossed and the I's are dotted. So you have this outside stress that's legitimately, I mean, you have a work deadline. Maybe you still have
Mhm.
symptoms. You have to deal with that. But now you're also adding more stress on top of that. So
Mm.
you're not just dealing with outside stress, you're also dealing with stress that's coming from the inside based on how you're relating to the outside stress. And what I've noticed is that some people can recognize this and say, I'm just going to stop doing that. And then they just start doing, they start practicing self-compassion and they practice better self-talk and whoop, they just pull out of it. They change their habits. But in my world, and I can't tell you exactly why this is, if it's because dizziness itself just interferes with so much that habit change can be so challenging, or if
Mm.
it's because just the people that I end up working with are the people who tried the habit change and it didn't work for them. But what I notice, at least with the people that I work with, is they know what they need to do. They just can't do it. They're like, I
Mm.
know I'm being a perfectionist. I know I'm resentful of people around me and I shouldn't be. I know that I create a bunch of my own stress, but I cannot stop. I just can't stop. And that's where the real work comes in. And I can certainly go into more detail on that if you want to.
So yeah, that would be really helpful. So what would that look like? Because I agree, there's plenty of people I work with too that are like, okay, I get it, I get it, I get it, I understand. I've watched all the videos, I've read the books, I listen to your podcast every single week, I've done
Yes.
your program,
Yep. Yep. Yep.
and also I don't know how to do this.
Yeah, yeah. So I always tell people, and this is just my approach. So I totally understand there are so many different ways to do this. So I'm just sharing what has worked for me or how I tend to look at my clients. But I like to start with what's here right now. What's
Mm.
happening in daily life right now? Like give me a sense of what's going on Sunday through Friday. Like who are you interacting with? What are the things?
Mm.
For dizziness, you won't necessarily notice changes in symptoms. So, this is another thing that makes dizziness tricky. With pain, often we'll tell people, okay, you can start to identify what some of your important stressors are by noticing when your symptoms fluctuate. For dizziness, often they just don't. You will just have them all the
Mm.
time, 24/7, severe, and then they'll randomly go up and down depending on what you're doing with your eyes. And they're like, does that mean that every time I look at my computer, I'm stressed out? Or is that just dizziness side effect? So, we can't rely as clearly on that. So I have to get a bigger picture perspective on what's actually going on in someone's life initially.
Mm.
And the places where these things show up, the I guess the not the red flags, but the trailheads. The flags that say, this is the stuff that I might need to work on. They tend to show up in how you relate to yourself and how you relate to other people. I mean, that's really where it tends to show up the most. So when I have to do something, what happens to me inside? Like, what do I do? What's the talk track?
Mhm.
What's the automatic response? And thinking of anyone in my life with whom I have with whom I not entirely harmonious relationship, which would I assume would mean everyone. I don't know anyone who
Mm.
has a completely harmonious relationship with anyone. What are the things that I've noticed to tend to cause the most friction? And what's the talk track that plays in my mind when that happens? So
Mm.
that's where I start looking. So we might start with an umbrella like, oh, Yonit, I know I'm such a perfectionist, but I need to know how that actually shows up in your life and what that's leading to, what kind of effects that's having, and what that process looks like. I'll ask people to play it out for me like a movie. Like, okay, so you had to interact with Bob, who you find annoying. So here you are, Bob shows up, play the movie for me. Tell me exactly what's happening throughout this conversation and what's going on in you. Give me like a narration of what's going on in you. So the point of doing that is to realize that regardless of what kind of change work you end up deciding to use, whether that's habit change or emotional awareness type practices or self compassion or parts work, whatever it is that you're using, you want to get specific about where the actual triggers are happening and where the change actually needs to happen. The big issue I see is that when people say, I can't change this, they're trying to change like this big conceptual thing like I'm a perfectionist, I'm just going to stop, but they don't actually know where these changes need to happen and what they can use to see that they're making progress toward that goal. They bite off just a giant chunk and they need to break it down essentially.
Yeah.
But then we have lots of options. It may be habit change. It may be I notice that I automatically do this every time I have to talk to Bob. Here's some small thing that I can change when I have to talk to Bob. So it could be just very cut and dry, or it might be something much more experiential. Like I notice there's this huge flare of resentment and anger that I feel toward Bob before I have this interaction with him. Let me stay with that and see if I can see what my mind and body are actually perceiving in Bob that's causing me to feel this way. And then we start breaking down the beliefs. So, did that explain a little bit more? Okay.
Yeah. Yeah. And essentially, a lot of what you're describing, right, is becoming aware of these not only tendencies, what affects us, but then learning how to work with them, be with them, whatever that looks like, right? So, like, the first thing I usually do with someone, because we talk a lot about the nervous system, is understand, well, what are your different nervous system cues, right? When are you highly stressed? When do you shut down? When do you actually feel grounded or content or neutral? So,
Exactly.
first that, and then we can help shift, right?
Right. Right. And here's the thing. I love what you just said. I think what people tend to see things as having like one-way arrows, like, okay, I'm going to change this behavior or I'm going to change this thought and then that's going to change this. All of these things affect each other. So our feelings affect our thoughts, which affect our feelings, which affect our thoughts, our beliefs affect our state, whatever. The good news is that means you can interrupt the cycle in many different places. But the bad news is that if you've got only one trick, which is like, for example, thinking differently, and you're not addressing other parts of the cycle, and if they're very strong, they're going to keep driving the cycle of behavior. So we keep coming back, or I keep coming back to this example of a perfectionist. But if you're trying something like habit change, which I said is really a very valuable way of doing things, but you're not addressing the feeling that comes up toward this hypothetical Bob person that ends up
Mhm.
resulting in you being a perfectionist, then the thoughts are going to keep feeding off of the feeling until you address that too.
Yes, exactly. That is actually, I just did a post kind of in the same arena of some people talk about just retraining the brain, right? And really like training the brain out of danger mode. Some people talk about the emotional work and the trauma work. And sometimes, not all the time, but there can be these two different camps,
Yes.
right? But actually, I mean, and kind of what you're saying, we do need both. We can't just focus on changing the habit and the thought. There's also the emotion underneath it.
Yes.
And which I can, as I say this out loud, I totally get can be a lot and a little confusing at first. So people get overwhelmed at first, totally understandable.
Yes.
We're asking a lot of you to understand these dynamics, and it takes time.
It does. It does. I'm a process thinker. I like thinking, like breaking down how I think about things in like multiple steps, which is why I have a YouTube channel. I get to
Yep.
make all sorts of steps. But that's one of my first pieces of advice to people. All of these things are connected, which may make it seem overwhelming, but actually it's good news because it
Mm,
means that you can work on one thing and you can start with that one thing and you are going to make an impact on your stress bucket or on your whole system even by working on just one thing in one way first. And coming back to this example of how I ask, how I will often ask clients to really break down an experience for me, you can do the same thing for yourself and start to identify what are these smaller pieces that I actually need to work on. And can I experiment with changing the thought or looking at the feeling or asking myself what the belief is and start to look for small shifts in just that one thing first and know that will have ripple effects later on all these other areas of your life.
oh, definitely, definitely, yeah. Okay, I want to talk about somatic tracking for a
Mhm.
second.
Sure.
People know what somatic tracking is most likely, even if you're new. The idea of paying attention to our symptoms and shifting our relationship to it, essentially, is what you mentioned earlier. But with dizziness, that looks different than a neck pain or a stomach issue or something like that. So, how does that look different? How do you talk about somatic tracking with dizziness?
Yeah, great question. So there are a few different ways to approach this. And of course, tracking somatically means you're noticing something in your body and you're just staying with it, you're tracking it. So for some people who have certain kinds of dizziness symptoms, for example, someone who has constant rocking, bobbing, or swaying, as will often show up with MDDS, they can do sort of a more classic somatic tracking. So they'll be able to hone in on a particular sensation. For most people, it's sort of localized. Like I notice rocking, bobbing, and swaying, and it feels like it's affecting my whole body. But when I focus on it, actually, it feels like it's coming from here in my head. And then when they find that location or a location from which it seems to be emanating, they can track that spot. So that's kind of the classic way. But as you alluded to, a lot of dizziness symptoms don't neatly localize. And sometimes they're very abstract and difficult to track. Like, how do you track derealization? Like, it feels like the world's not real. How do I track that? Right. So, my go to for those kinds of symptoms is to have people track their reactions to those symptoms. And for most people, those reactions are either fear or frustration, among others, but those are the big ones, obviously. So, fear is definitely an embodied experience, as is frustration. People can typically locate fear and frustration in their bodies. So, I will invite people to notice the sensation and then notice their reaction to the sensation and then stay with the reaction and track that.
That's similar to how I talk about fatigue.
Yeah, that makes
Fatigue
sense.
is an all over body, right? And I get that question all the time. What do I do with fatigue? How do I track that?
Right,
Often there's resistance there. There's fear, frustration, overwhelm, anger, blissness
right,
that comes up
right,
with it.
exactly. There's so much. I would say, though, there's a third category for dizziness, and that's stuff like vertigo. So
Mm.
the thing with those that they're intermittent, some of them are provoked, so they're triggered by certain movements. So for example, people with PPPD will often have movement specific triggers. Like if I turn, I get this whoa or like this whoosh or this dropping feeling, right? How do you track that when it only happens when it's triggered? And that those are obviously the most fearsome symptoms too, sometimes because they take you by surprise or catch you off guard. So, one thing that I always like to tell people, and I hope people who are listening can really take this to heart, you are not trying to play battleship with symptoms. So, we're not trying to eliminate a symptom by smashing it with a somatic tracking hammer. Okay. So you don't need to track each individual symptom to make it go away. So, you may have some, like the ones I just mentioned, that you really just can't track, although I have some suggestions on how you actually can. But you may just say, you know what, I'm just not going to track that thing. And I'm going to track these other symptoms that scare me. And in doing so, you are still creating a shift in how your brain understands symptoms in general. And hopefully, you've also heeded our advice from earlier and are not just working on your fear of symptoms, you're also working on all these other things in your life, the stressors, the ways you relate to yourself and other people in stressful events in your life. And when you do that, you also bring down the levels of danger in your system as well. And what you'll often find when you sort of say, fine, you know what? I don't care if you're there anymore. I'm not even going to track you. You know what? So be it. When you get to that point, a lot of the time, that's sort of like a bring it on. I mean, that's sort of like a, you know what? I'll just have to handle it if it happens. That kind of attitude actually is the whole point. It's what we're trying to actually use somatic tracking to get to, that kind of attitude. So you're accomplishing often the same thing by not somatic tracking, specifically a symptom that you can't somatic track. But that said, you still can. You still can. It's just not as easy. So one thing I will use, of course, is imagery. So I'll have people imagine the symptom happening. And what will often happen is they will notice fear reaction. So even if they're not actually experiencing the vertigo or the drop or the gravitational pull in the moment, they can imagine it well enough to actually have a fear response. And then I'll have them track that. So I'll have them stay, oh, there's the sensation. I want you to imagine the sensation. And when you notice that feeling in your gut, that feeling of fear right after that, that's what I want you to hold on to and track for a few seconds here. Another way to do this is I have had some people do this, actually provoke symptoms on purpose, believe it or not. These are brave souls, but all of us used to spin around as kids to make ourselves dizzy because we thought it was funny. Okay. So I have had people, I'm not saying anyone actually needs to do this. I think this is kind of hardcore, but you can actually spin yourself around or do something specifically to provoke so that you can somatic track for a few moments after it happens.
Yeah, makes sense. I mean, getting to the root of the point of somatic tracking is working with the fear in the first place, or what we're trying to get to, like you mentioned. And that's huge because we're not then bypassing and just trying to get rid of it by somatically tracking, which happens all the time, right?
Oh, yeah.
And actually expanding our capacity to be with what's underneath and causing more symptoms in the first place.
Yes, that's
So
right. That's right.
yeah.
And I really want to emphasize that too. It's good to, I'm so glad we're talking about somatic tracking. It's a great tool. And also, I see it misused a lot because people are
Mm.
understandably like, get this thing out of me, like, get this symptom out
Yeah.
of my body now. But ultimately, I personally have spent a lot more time with my clients working on that other stuff, usually. The symptom response piece needs to be there. But if we're not really addressing any of these stressors, then we're not really cutting the fuel lines, so to speak, to the symptoms.
Exactly. That's where so much of the work is. It's almost like this is kind of this entry point to understanding how to attune to be with our symptoms without as so much fear,
Yes.
right? So, yeah, definitely.
Yeah.
Okay, what about for some people? Because I work also with people with IC, OAB, like bladder type symptoms. And a lot of times for that, I've noticed with some different symptoms, there can definitely be an increase in the symptom when we start to pay attention to it, right? And
Yeah.
yes, we can talk about how fear is increasing that and reducing the fear. And also, I just validate people as a reality to, okay, yeah, you are focusing on it more and symptoms are increasing. So, how do you talk about that with people with dizziness?
That's a great question. Obviously, the first thing I'm gonna check in with is the intention and the attitude. So, are we going in there to try to eliminate symptoms? Are we trying to get rid of it? Are we still terrified of symptoms? Are we thinking somatic tracking is the magical tool that's gonna solve everything? All of those things are gonna just make it not work and increase symptoms. But yes, attentional focus on symptoms does increase your brain's attention on symptoms, meaning
Yeah.
it's gonna increase the volume dial. It's going to. Here's the way I think about it. It's the spirit of somatic tracking that we're trying to learn. It's the skill of responding in a certain way. It is not actually designed to be a 15-minute meditation. We do not need to spend 15 minutes lying down and thinking about something that we don't want to pay attention to. That's not actually the assignment. Some people love doing that, and I encourage them, if you enjoy doing it as a meditation, if you enjoy doing it for a prolonged period of time, then do it. But actually, what we're trying to learn is how to glance at the symptom, respond in a neutral slash attuned slash curious slash kinder way, and then to go back to doing something else. That's actually the skill we're trying to build from my perspective. We can just skip all the let's focus on the symptoms part and just practice that slight touch point, like acknowledge, there it is, respond to myself with compassion, maybe a breath, and on we go. We can just go back to doing what we were doing.
Yeah, I love that. And there's so much permission in it and flexibility. Like it doesn't have to be like a lot of us will take on this all or nothing, rigidly healing
Yeah.
type place, right? And we just want to do it the way that it's supposed to be done.
Yes. And also, even across different symptoms in the same person, you'll find some symptoms are trackable and some are not. Personally, I have not had actual migraines for a very long time because obviously I've I've done a lot of this stuff for them, for myself. And in response, my body said, no more migraines. But when I've had, I mean, maybe in the last 5 years, I've had maybe two. Okay. When I have attempted to do somatic tracking when I have a migraine, I simply cannot be with the sensation without getting upset with it. It's just too, it's an all body. Migraines are not just head pain. It's a whole body nausea, thing, it's bad. I can't respond to my sensations in any way that's useful or neutral in that moment. So for me, it would look more like what I described, like acknowledge, and then I move to something else. Maybe acknowledge, and then I move to something else. And I'm still accomplishing the same thing, but without the sustained focus.
Yeah. Yeah. That titrating
Hmm.
moments
Yes.
is exactly, exactly. I love that. Thank you. Okay. One more little segue, or not segue, but topic, I guess, with any symptoms, we can start to become afraid of the outside world, obviously, certain situations, going out of the house, doing things, travel, social, whatever, right? And so, especially with dizziness, there is this derealization and like fear of what if this happens in public and what am I going to do? So, how do you think of exposures without this maybe more extreme, like, well, I know it's my body, so I can just do it. I'm going to force myself and do all the things versus no, I can't do anything and I have to be completely safe before I try anything.
Yeah, this is so tricky. And what came to mind when you said that was driving in particular. Yeah, because I could make the case for why you should still go to Costco, even if it feels terrible. Costco, by the way, for people who've never had sustained dizziness symptoms, Costco is like the final frontier. It's like a dizziness fun house. I mean, it's just bad. It's so visually stimulating. The big open space makes you feel very disoriented. I call it vestibular therapy max. Like it's really intense. But I could still make the argument, listen, I know it's going to be rough, but ultimately you're safe. Like you go to Costco, and if you feel dizzy, then if worst comes to worst, you'll sit down, right? But then in some cases, like driving, there's actually a potential safety issue. Or I have people who have actually typically, okay, this is a little tricky. Sometimes
Mhm.
people have had falls, and then they're like, okay, but going to Costco actually isn't safe. I could fall and actually hurt myself. Yeah. So generally speaking, I will start with having people titrate these exposures in ways that are truly less risky. So for falls, I have no shame about this, and people may not like to hear this, but I will tell people to use a cane. I will tell people to use a walker. And I know in the mind body world, oh my gosh, like there's nothing wrong with you. You
Mhm.
shouldn't be using any stuff. You need to actually meet yourself where you are first. That's my big message. I think everything I'm about to say will fall under this headline. When it comes to these actual or perceived safety issues, you have to meet yourself where you are first, and then you can think about how to progress. I think so much of the fear comes from thinking that it's all or nothing. You have to do this thing and it has to be in this way. Otherwise, it doesn't count. And that's just not true. This is why I'm just constantly talking about process oriented goals. You have to
Yeah.
focus on the process and not just in the platitude way. Really, again, I'm a data person. I like processes. You should have very clear goals for yourself. Like, what does an improvement mean that's not symptom related? And
Mhm.
then when you start to do that, your courage will grow, your fear will drop, likely symptoms will drop too, and then you'll be able to increase the intensity of these exposures. So, for some people with dizziness, that truly may mean you get into the car and you go nowhere. I mean, that may be what you're doing to start off with. It may be you're driving around the neighborhood, and it may be that you have to have another person in the car with you for a while.
Mhm.
All of that, and here's the tricky part, right? Because some people will come to me saying, I've already done that and now I'm stuck with this person. Stuck
Mhm.
at this lower level of exposure and I don't know how to take it to the next level, but I need this person with me to feel safe. The issue here is the framing under which you're doing all this changes once you understand it's a neural circuit issue. So if you've just been powering through trying to expose yourself to driving, like, I'm just going to get rid of this and all I need to do is just push through and it'll work out. If that is not the same attitude that you have now, that you understand this is a neural circuit issue, you understand it truly is a brain prediction issue, and that your brain needs you to feel safer, not safe, but safer in order to rewire, and that it's totally possible to recover and for the symptoms to go away. Now that you know that and you have a totally different framing on it, you have to meet yourself where you are right now without shaming yourself. And only then will you be able to make progress from where you are. And then you could be creative about how exactly you progress from there. The
Mhm.
biggest barrier I see, it's not that people can't progress their exposures, it's that they're stuck in kind of this black and white thinking about what they should be doing right now, what I say
Mhm.
they should themselves stop shooting yourself.
Yep.
So if you can stop shooting yourself and say, okay, this is where I'm at right now, but I do understand that I can get better from here. How can I creatively increase the intensity here in a way that straddles the line where I don't maybe necessarily feel 100% safe, but I also am not completely flipping out? You can always find a way to advance what you're doing.
Yes. Thank you. Thank you for saying that, especially with like we probably share this information similarly. I always talk about supports. You can have your supports. It's okay. It is not a crutch. You are not telling your brain that it's only physical just because a
Yes.
few of these things,
Yes.
right?
Yes.
As
Yes.
long as you have this understanding and like you said, you are working towards this. Fantastic. Helpful, supportive. Yeah.
Like you wouldn't I love my metaphors and I tell people, would you go put 300 pounds on a squat rack with having never trained? Of course you wouldn't. You'd
Right.
probably be starting with body weight and then you'd maybe, grab a couple dumbbells. I mean, you'd be working your way up to something like that, right? So why wouldn't you expect to need to do that now? And to follow that metaphor, similarly, let's just say you were trying to work up to this squat and you found out your technique had been totally off the whole time. You'd probably need to start back from the beginning or close to the beginning and work your way back up. That's exactly what you're doing now with these exposures. If you were powering through, like, I'm just going to force myself through this and everything's really dangerous and I may never recover, that's technique that was maybe not optimal. So now you're going to do it differently with better technique, but you're going to need to meet yourself where you are to be able to advance.
Exactly. Exactly. We can't expect ourselves to also for it to go perfectly well, right?
Hmm.
I'm sure there's ebbs and flows and you expand
Totally.
yourself a little bit and maybe you get a little more dizzy, but it's not all lost. Yeah.
That's, of course, a huge thing. And I know that happens everywhere in the mind body world with all symptoms. But because dizziness also just sort of naturally affects mood and causes anxiety in and of itself, even without any kind of psychological, like, oh, I'm catastrophizing, dizziness itself is accompanied by anxiety. When people have these, we call them dips. Like when you have a dip and your symptoms increase. When people have these dips, they're often taken off guard by how much worse they feel psychologically, and that's not driven entirely by thinking about it poorly or not having the right attitude. It's physiologic. And this is just important for people to know. Also, I know I interjected there without a whole lot of context,
Hmm.
but it's
No,
important
please.
for people to know when they're doing these kinds of titrated exposures that you're going to have ups and downs. And the way that you feel about it is also going to be accompanied by a lot of ups and downs. And not all of that is being driven at all by something you're doing wrong at all. It's just part of what happens to your body when you feel disoriented, which is again why those process goals are so important because then you'll have numbers for yourself. Like last week, I was a jerk to myself 5 times during the drive. And this week, I was a jerk to myself only 3 times during the drive. I'm making progress. Like I may feel bad right now, but I have data showing that I'm actually improving.
That link to the psychological process, the mood shift, I think that was really important to be said. So thank you because yes, it happens with all symptoms for sure. And also, yeah, I can only imagine the amount that it can happen here and like the link that's
Yes.
there. Yeah.
Yes. This is something I want to preach about to the mind
Yeah.
body world all the time. I'm like, just let me talk to you about this because there's an assumption often that anxiety, depressive feelings are psychological in nature. And of course, we always want to look at that possibility. Of course, there's some contribution. There's also a just kind of a natural physiological response when you feel disoriented. Your body's like, okay, you need to sit down and get in bed now. Like you're actually in danger. You don't know where you are in space. It's the most important sense we have. I will also die on that hill.
Mm,
We need to know where we're oriented in space far more than we need to be able to see where we're going or taste our food. Just orientation, if you think back to the most primitive organisms, the number one most important sense is knowing where they are in space. Doesn't matter if you can find food if you don't actually know where you are in relation to the food, right? So there's a reason why it makes you feel so bad when you're disoriented. And as soon as you can call its bluff and say, this is just my brain chemistry, like actually just fooling me, like trying to mess with me, it feels so much better. You can separate from it.
yeah, for sure. Okay. So, and on that note, is there anything else that we have not talked about that you feel like is really important for people to know? Because this is great. We need people to understand this.
Yeah. The only other thing that I think that we haven't mentioned so far directly is just the anxiety piece. So if I can
Mm-hmm.
say a word about that.
Yeah.
So obviously one of the greatest risk factors for someone to develop chronic dizziness after having an episode of dizziness is pre-existing anxiety. Now, that's true. However, as we were just talking about, disorientation has a way of messing with your physiology. Most people, over 90% of people with dizziness end up with anxiety, even if they've never had anxiety before. And this messes with people so hard because I work with people every day who've never had an intrusive thought in their entire lives. And then suddenly it's like their brain turns on OCD mode. And I'm not making light of OCD. I'm saying they actually develop sort of obsessive compulsive disorder type thought patterns that they've
Mm,
never ever experienced before. So I just think this is such an important thing for people to understand, because when they're experiencing dizziness, it's not just physiologic terror. It's not just, oh, I don't know where I'm oriented in space. It has these downstream effects that end up producing thought patterns, distressing and disturbing thought patterns that, again, are just natural brain stuff that's just happening because your brain is disoriented and trying to figure out what it means. And it's
yeah.
not actually you. It's not that you have a psychological problem now and now you have OCD. It's an effect of the disorientation. However, it does mean that to recover from dizziness, if you're also experiencing fear and anxiety and obsessive compulsive thought patterns, etc., you're gonna need to address those. I don't like using black and white language, but in my experience, you can't recover unless you know how to address those things. You have to know how to work with that fear and anxiety. That is, in my opinion, probably the biggest obstacle for the majority of people who are dealing with dizziness. It's not exactly response to symptoms. It's not exactly stress. It's I'm being attacked by my own mind as a result of the disorientation. And I believe it. I believe the thoughts that are happening, and I'm basically engaging in compulsive behavior or compulsive thinking to try to stop it. And now it's become its own cycle. So I strongly encourage people who have dizziness to take just a slight detour from the mind body world and look up some good anxiety specific resources. You're probably going to need them. And I can give them, I can list some if that's okay.
Yeah, for sure.
Yeah. Dare. So DARE. They're great. They're a great resource. Disordered, or Drulin Salata. He has a great podcast on anxiety. The Anxiety Guy. Just some resources to get you started. Anxiety RX by Russ Kennedy. Everyone with dizziness, almost everyone with dizziness, is going to need those kinds of tools as part of the recovery toolkit.
Thank you so much. Also, I want to highlight for all the therapists and coaches that are listening to this, because we have a few here, or quite a few. I mean, I think that's so important as a therapist myself to recognize that, to understand that link. And part of what I'd like to get out in the world is to help therapists who don't know this work, who's never been trained in PRT or
Yay!
EATs,
That's
to
awesome.
understand it, right?
Yes. Yes. So
Because
glad you're doing that.
there's such a gap. There's such a gap in the therapist community. And so my point being, yes, just please understand this too for your clients,
Do not
because the way that we
assume.
would work. Yes,
Yes,
exactly.
especially since so many of you listening, right, are probably very trauma informed and are really
Mhm.
ready to dig in deep to that stress bucket. Like, oh my gosh, what's all the stress, the perfectionism or whatever that's
Uh,
led this person to this place. Do not assume that the obsessive compulsive stuff or the anxiety or the health anxiety or the fear that's
yeah.
coming from that. It may actually just be a side effect of the dizziness symptoms themselves. And you treat them as symptoms, true, but there are certain ways of treating them as symptoms that are different from how you would treat a physical symptom. For example, messages of safety and reassurance, not the right move for intrusive thoughts. It actually tends to make things worse. So it can be really tricky because you kind of have to both give reassurance about symptoms, but not reassurance about the fear at the same time. It's an interesting needle to thread, but this is why I'll often work in stages. If someone's dealing with a lot of the fear and anxiety, we work there first, and then we'll move on to stress related stuff.
Okay, that makes so much sense. Also, I hear another episode coming into play regarding treatment. Oh my goodness. Okay, thank you so, so much for all of this. I know it was incredibly helpful.
Thank you.
Is there anything else you feel like is important to note as we wrap
Yes.
up?
Most
Yeah,
important thing is I don't care how long you've had symptoms. You are not the exception. And day one of your recovery is the day that you realize that you can recover. So if you've had it for 30 years or 3 months or however long, does not matter. Day one of your recovery is the day that you realize you can, and you can.
amazing. Highly, highly back that as well. Okay, we will of course link everything, your YouTube channel, all of your resources, website below.
Thank you.
And just really appreciate you coming on. Thank you so
Thank
much.
you. Thank you for having me.
You're welcome. All right. And we will talk to you all next week.